Hi, guys. So, as you can clearly see and figure it out, I'm very, very new to this. I hope you can share the new link with your friends and people. Uh, let's give it 5 to 6 minutes, I guess. मैं ठीक हूँ यार जैंश, how are you? uh, we wear a mask, so I'm clear. And as such, they have better things to scold me in the ward than my beard. So it works out keeping a beard. I have not been clean shaved since my medicine practical approximately 2.5 years back. I think 2 years back, yeah. I'm good. I'm actually good. I'm currently posted in gastro, so it's fine. It's binomial duties. I would say the duty days on which you're on call is very hectic. Apart from it, it's fine. So, acha, okay, Dr. Amule, okay, आज morning we had a session but under Dr. Rajat sir. He's the best. Dr. Rajat sir is the best. Rajat sir is like has been a godfather to me. I cannot speak highly enough of him. He's the best. So, how is your duty? Currently, it's fine as I told you, but wards are hectic. But wards are the best. I feel medicine wards. Timings vary. Like when I'm not on call, then the duty hours is like I go in morning at around 8 a.m. or so. And let's say if it's a light day, I do not have much patients or the patients are not sick as such, I can get free by 8:30. But there is no last point. It can go up to 1 to anything. As and if you're on a bad day, then you probably sleep there and wake up in the morning there only. And but yeah, it's fun at times. It's really tiring at times. It can get frustrating, but that's part of any residency. Hello, Dr. Akansha. She's Dr. Akansha. She's currently pursuing radiology, and she's going to be the best at it. I know that for sure. She's a legend in herself, and I like. She's really, really good. So everybody can say hi to Dr. Akansha. She secured rank 9 in INICT. She took up surgery in at Ames. Realized it was not the thing for her. She had the balls. She had the guts to drop that. Give another attempt. She scored rank 15 in neet and then ranked 30 odd in Ames INICT, and she's currently joining Ames Radiology, Interventional Radiology, and General Radiology at Ames Jodhpur. So that's Akansha. Yeah, if you have done edition 5 and if you're confident in that, do not try to redo everything. It's not a really good thing. Good evening, ma'am. Good evening, Rama, ma'am. How are you, ma'am? Uh, uh, Rama ma'am, as you most of you must be knowing, I have studied OBG from her, and really really appreciated her always. And she was probably the first one to tell me that I will get a good rank. I still remember that in the class itself, and after that on Facebook, like I used to ask her doubts. So she did tell me that I can get a good rank if I work for it. Thank you, ma'am, for believing in me. And it's a honor to have you here, ma'am. Thank you. Okay, so GT, yeah, coming to GTs. So, firstly, okay, one more thing here. Can you please share the link, the new link to the other people if they are wanting to join in? I'll just share it in some groups that I know that would not ban me. Yeah, guys, just give me 5 minutes. I'll take up all your questions and we'll have a good session. I promise you that. And meanwhile, in these 5 minutes, please share the link with whoever you can. Okay, because I think a lot of people might be looking at the old link and might be thinking what the hell is going on, why it's not working and everything. So just give me a few minutes. Anyway, so yeah. Okay, so GTs. I think GTs is a common question for everyone. How to get your head right in GTs, how to score good. So first of all, attempting GTs is very, very important, and I cannot stress enough on that. Okay, and GTs tell you where you are going wrong, what are your weaknesses. It also tells you what are your strengths. Okay, and that is very, very important to realize what your strengths are and how to keep your strengths and work on your weakness to make them your strengths. That is very, very important at the same point of time. So like attempting the GTs, 3 hours, 3.5 hours actually, and 200 questions, or 200 questions and 3 hours with respect to INICED. So you have to attempt it accordingly, like basically give 1 minute per question. And if you need to keep a track of my what I used to do is, like, if the time clock is in minutes, I always used to make sure that the number of minutes left on my watch is 30 minutes. It's 30 more than the number of questions I have. Approximately, yeah, 25 to 30 minutes more than the number of questions I have left. Okay, and also one thing I used to do, like, if I'm going through a question, it's a decision making question, and I'm like asking myself, would A be the option or B be the option? And I'm confused. I ask myself the second time if A will be the option or B will be the option. The third time I just skip the question for that time, because I'm all confused between the options. I'll most likely end up marking a third wrong option. So I sometimes skip that question, but this is all keeping in mind that I have time left on my watch. Okay, do not spend excessive time on one question thinking that this one question will get me some extra marks, because each question has equal weightage. So if you answer a few one liners, if there are, or some easy questions that you might have to leave at the end because you do not have time or the time finishes, that would cost you, some easy questions as compared to a tough question that you took a lot of time. Okay, and so yeah, that's how you should manage your time. You have to strategize for yourself. Like, whatever strategy I tell you might not work for you. You have to strategize for yourself the strategy which works best for you. Okay, and yeah, it's always like I always used to attempt high, because I always believe that matlab, number of attempts need to be high in respect to the targets I had in mind. But I worked my way through it. I'm not saying you go out in your first grand test and attempt everything. Okay, you have to make your pace at your pace. Everyone is different, and you have to strategize according to yourself. Okay, and that will come only as and when you practice. That's why attempting GTs is very important, so that the eventually the last paper that you attempt turns out to be you're the best GT. Okay, I'll give you an example. Very, I don't know if famous, but a very thoughtful story was there. A teacher asked 100. He had a class of 200, an art class or something. He asked them. He divided them into two groups. He asked one group to design one pot as good as they can. Okay, and the other 100, he told them to design 100 pots. Okay, one after the other, without telling them to design it as good as they can. Okay, as such. And at the end of, let's say, 10 days, 15 days, 20 days, 1 month, what do you think, who had the more who had the more beautiful pot, or who had the better pot. It was actually the 100 pots group, okay, because that they have practiced from pot 1 to pot 100, okay. You need to practice from GT number 1 to GT number X, whatever that number is, so that your GTX, which actually is your paper, feels like a GT, and you score brilliantly in that, okay. You score your best in that. That's what practice does to you, that's what GT does to you, okay. Attempting GTs, do not try to overthink, okay. Try to keep things simple. Try to be, focused while taking a GT. Try to, know whatever factors there can be which can affect your concentration, which can affect your scores in GTs. You can, initially first 2 3 GTs, you can make a list of everything that goes in a GT, and like sleep or disturbance, maybe someone comes into your room, disturbs you, so that is very important. Okay, so yeah, so coming on to GT attempt, so yeah, so the list is very, very important in terms of the factors that can affect your GTs, and that is different for every person. Okay, so make a list of whatever points you can and work on them. Okay, after that, reviewing the GT. Okay, reviewing the GT is an art which you learn as in when you move forward with it. Okay, um, like what I used to do was I used to make 3 columns. One was the random new topics, which were like no one would probably ask, or how much I read, I would not probably able to answer them. I did not used to give much weightage to that. Second was the column which was due to lack of revision. Oh, thank you, Aditya. Thank you so much. Much appreciated. So yeah, second is the column where the questions which are your lack of revision, basically the questions which they are you have read at some point of time, they are there in your notes, or some other short notebook, or 20th notebook as some people call them, or some review of GTs you have collected, but you do not remember it. So make sure you visit it there and then, and you put it in the second column, the lack of revision column. And the first column, and what was most important to me, was the column which is the silly mistake column. And that is the target, to reduce that column to at least 4 or 5, and to eliminate the second column. Okay, you will gradually move forward with this. This is a strategy you can use. And yeah, that's basically in short GTs, but GTs deserve a whole video for it, and I'll try to come up with it soon. Okay. Okay, so yeah, a lot of people have asked about FA. Okay, so first aid is a very, very good source. The best part of it being, there is nothing which is not important in that book. It is a very, very concise book, and it is more of a revision book for us. Okay, revision book, as in, if you're already thorough with your notes, previous year questions, getting decent scores in GTs, then you can read the whole first year in 3 to 4 days. Trust me on that. It might sound a little overburdened, but you can read it. I thought that myself. I had a conversation with Tamim sir. You all must be knowing him. And I still remember, like, our previous NEET was supposed to happen on 18th of April, and approximately at end of March or something like that, at end of March or something like that, I had asked him that should I read first aid, and Rajat sir also had asked, should I read first aid. Rajat sir was like, he give 4 days. Tamim sir was, I asked him how much days would it take approximately. He said 3 to 4 days, and I was like, how is that possible? But you know that they are experienced people, and what they say is true. So I was able to complete the systemic part. I did not read the whole first aid. The systemic part I read, and I was able to complete it in 2 days, 2.5 days. Okay, just a minute. I'm getting a call from board. Hello. Yeah, sorry for that. So yeah, so I was able to do it in 3.5 days. So that is something when you're already thorough with your notes, you're already getting a decent score. You can go through first aid, revise your entire content, a lot of content, not entire exactly, a lot of your content through first aid. Mark whatever is new to you in first aid, because that is important. That is new to you, but it is important if it's there in first aid. Okay. And give some time, let's say half a day or one day, to revise your highlighted parts. Okay. That is how you can go about first aid. One is. Second is, you're starting now, you do first aid together with your notes, and keep annotating from first aid in your notes, or in your first aid from your notes. Okay, so I think everybody can see Dr. Devendra Jain in the chat. He is a colleague of mine here at AIMS. He is currently doing MD medicine with me. He secured rank 16 in INICT, and we are currently together in MD medicine. So we all can wish hi to Dr. Devendra Jain. Yeah, so uh, you can do all the subjects. You can choose, like I would say, you can do definitely do biotech and biochemistry, uh, and micro is also very very good. Micro is really good, and yeah, those two definitely are very good. I did not like general path much, although people do say that it is very good, but I was like, it's fine. I did read it afterwards, but I was okay. Like I read it because I wanted to, but I did not find it very very useful, because maybe because I my notes were decent enough, or maybe whatever the reason is. Okay, that is my opinion. Okay, not something which is, you know, a stamp on it. So yeah, plan for last 10 days to cover up all the subjects. Nirmala, this is a very good question, and I would suggest, something, the plan for last 10 days, or let's say 2 weeks, doesn't form before that. It forms way before that. Okay. As in, like, you can start uh, from now. The best things to do in the last 2 weeks or 10 days is the previous year question topics. You can cumulatively, like what I did was, I used to stick up some flags in my notes, and at the later part of my preparation, I used to, jot down some things, click photos from my notes, and stick it all up in my OneNote on my iPad. And I revised that in my last 7 days, and it was a good source of revision for me, just the previous year topics. Okay. um, the thing is that if you do it after one or two revisions, the lesser would be the content, because some of the things you would be thorough and you would not want to write it down. Okay. uh, we will always have super competitive colleagues like Ritvik and Kirtana. I don't know who Kirtana is, but I think I have heard about Ritvik on Zena ma'am's group. So try to push yourself with them. Do not let them be your anchors. Do not let them tell you that you're inferior to anyone. Do not let them do that, because you're not in any way inferior to them. Okay. You need to trust that. And that's just 1% or 2% or 3% or 4%. It doesn't matter. Okay. It really doesn't matter who Ritvik Sahu is or who Kirtana is. I hope they are good persons. I do not know them. They are there. They are them. They are not you, and you do not want to be them. Why would you want to be some other person? You have a different identity, and you need to work according to that. You cannot be overburdened by anyone else, and that's very, very important. Okay. You should, like, I guess they have a lot of knowledge. If you can gain from that knowledge, well and good. If you cannot gain from that knowledge, you have your own mind, you have your own knowledge, and you will gain from that definitely. Okay. So you should not be intimidated by anyone. Okay. That is for sure. Thanks, Aditya. Okay, so I think someone in the middle had asked me about third year. So third year is like probably a very very good year in the sense to make or break. In the sense that a lot of people call it, the chillest year of your MBBS. But I had a decent third year. You need to strike a balance. You need to have time for everything. I used to study when I used to study, and I used to enjoy the crap out of life when I used to enjoy. Okay, so honeymoon phase, right? We actually had two honeymoon phases in our MBBS. Well, first was third sem, and then the third year. So basically, my point is that in third year, try to attend whatever classes you want to. Try to attend uh, the clinics or the wards, whatever you call them at your place. Try to see patients, try to read standard books as much as you can. Try to start reading Harrison's topic wise, not exactly cover to cover, definitely not cover to cover. Try reading some topics. Initially, it would take a lot of time, let's say 1 hour on a page. No matter, give it. It's a good investment, trust me. Read Baileys if you want to. Okay, these are the two books probably which you should read. And I would also suggest you reading Parks, which is a very, very uh, good book. But yeah, you should definitely read it. Okay. Uh, Krish, no, I would not suggest you completely do it again. Maybe they will release some update videos, or maybe you can see the update question bank. Uh, you can do that. Okay, I don't think you need to do it again all over again, because like my notes, most of them were from my third year, which was in 2018-19. Most of my notes were from 2018 and 19. I attempted the paper in 2021, and I guess I did fine. So it's not about how many new type of videos you do, it's how many times you revise the same thing. That's very very important. I know Park is very monotonous, but Park will hand you good knowledge and would hand you a lot of questions. If you have access to up to date, definitely you can go through up to date any point of time. But but at your level, do go through clinical books, do go to wards. Do not consider any source of lectures or any source of videos as a substitute to standard books or patients. Okay, short subjects best is to just read from notes. And why is your purpose to defeat Ritvik? Why do you want to take that as a motivation to defeat Ritvik? It is no, it is fine. Do not delete it. It's fine to have that, but I want to know your only motive should be to become a better version of you. Hey Aditya, don't go. You're a good person. Stay here. Okay. You should be motivated for yourself and no one else. Okay. You should be motivated for your dreams. You should be motivated for your goals. Ritvik is not the reason that you have studied so hard, reached MBBS. Okay, Ritvik is not the reason why. I don't know why I am mentioning. He must be a great guy. I do not know them, but okay, please. Medicine, how to do? Uh, okay, it all depends on what year you are. I'll talk about if you're an internship and attempting NEET 2023. Hopefully, to attend a class, preferably a face-to-face class. Preferably, if you cannot do that, do any class you want to. Okay, but trust that source and read it again and again. Do questions from whatever source you want to, but focus on previous year questions the most, previous year topics the most. And medicine is a subject which, at after some point of time, you'll be like stuck at a particular score. And you will be stuck at a particular score, and you'll not move forward, and it's fine. Medicine is like that. Medicine is a very vast subject. At that point of time, you need to gather your balls, you need to gather your guts, and you need to focus on your weaker short subjects, because they will give you a higher benefit as when compared to time benefit ratio. Okay. If 30 questions you're doing 25, 24, it's fine. Anything about 23 is fine. It's good enough to understand that if you are reaching 25, and let's say if in derma you are getting 4 out of 10, it's easier to get 8 out of 10 in derma than to get 26 or 27 out of 30 when you're already getting 25 out of 30 in medicine. Are you getting my point? This is very, very important to understand. Question bank, focus on previous year questions first and then move on to the rest of the questions. All the question banks in this current scenario have much more data and much more content than you want and than you need. Okay, so you need to sort it according to your needs, according to your topics. And how do you know that? That is according to the previous year topics. Okay. Definitely, from 140 to 160 is definitely. Uh, I'll tell you a story of my friend, a very good friend of mine. Okay, currently pursuing pediatrics at a very reputed college in Delhi. So she used to score around, like out of over 200, she used to be around 150 plus minus 10, plus 5 minus 10. Let's say 140 to 165 was a range, and all her score was dependent on her state of mind on the when she used to attempt GTs. As in, how confident was she? How was the previous GT she had attempted? And that used to lay the ground for the next GT or the GT she was attempting thereafter. So, my point being, a mental state can be so important that it can end up taking your score anywhere. So, she ended up getting 170 correct, a rank of approximately 300 in NEET 2021. Yeah, so it's definitely possible to jump scores. You just need to believe in yourself. You need to, you know, lay down the path for yourself. You need to see where are you going weak. And can be a lot of times, it can a lot of times be not the academic parts you're weak at. Okay. This is my important point, how non-academic factors affect your result. Confidence, very, very important. Trusting yourself, very, very important. Do you have the guts to back your answer when you're not sure about it? Do you have the guts to back your concepts when you're not sure about it? That is very, very important. Your mindset, the pressure you have to perform, the stress you have, the more relaxed you are before any paper, the better you will perform. Definitely it's advisable to take breaks. It is definitely advisable to take breaks. We used to take breaks every Sunday after the GT, or any day we used to take GTs. That is very, very important. Breaks are very, very important. Okay. No, you can take a whole day break. It's not necessarily a 15-minute break. You can take a whole day's break. Okay. Medico Corner. Currently, I'm doing MD medicine at AIMS, New Delhi. Uh, how to plan space revisions? Okay. Okay, I probably am not familiar with this concept of space revision as much as you guys might be, but I'll tell you some revision strategies. Probably they're space, I don't know. I don't know what you call them. Okay, I did not have any name for that. So like, you need to plan your every read in order to make your next read easier and the next read after that easier. Okay. Like, first read might take you 5 months. The next that 5 months you need to invest to make your second read easier. Okay. The second read, which might take approximately, let's say some might do it in 50 days, some might take 2 months, or 65, 70 days, whatever it is, that is targeted to make your next read easier. Okay. Are you getting my point? Please do not rewatch the videos. Please, please, please do not rewatch the videos. Can you please, Anirudh, can you please resend the message? I might have missed it. Can you please resend the message? How do you make the read easier? Yeah, okay. So you can always cut down your notes, okay? You can always summarize your notes, okay? If you are reading some topic for 30 minutes, try to compile it in a way that you do not spend more than 15 minutes the next time. Then after 5 minutes, okay? uh, that is how you can do it. Yeah, that's very well said. Solve one source and revise 1 million times. Yeah, you can do that. uh, yeah. So yeah, so you'll realize it when you are reading that you need to realize it that when you're reading, how to cut down your notes, how to filter out the unimportant things, and you need to have the guts to cut it off. Like I realized this a lot later, and I then used to just take a pencil, cut down my notes. Like I know this, cut. I know this, cut. Will not read it the next time. Ah, come on, definitely, Aditya. I'm definitely longing to meet you. You will be a fun person to meet. I'm on duty tomorrow, on call tomorrow, so I'll be there till day after morning. So you can come at any time you want to. I'll be there. No, no. I the notes, cutting the notes or summarizing the notes, I did it in the same notebook. Your notes will always be there. Okay. And I had one secret. I always focus on concepts. I always focused on balance. I never thought that I was only about studies. I had a lot of hobbies. I had a lot of fun. I traveled a lot. I lived my college life to the fullest. I made a lot of friends and everything. Yeah. So balance is very, very important. Okay, balance is very, very important. You need to strike the balance. And when you study, study hard, study with the motivation, realize your goals. People don't realize their goals. They do not realize what their potential is. They do not realize what they want, what they can do. Okay. Dikshit, I already said a lot of things about first aid. I'll tell it again sometime, but I think you can see in this video, or you can text me if you want to. I'll send you a voice note. No issue about that. Yeah, FIFA 2022. You know what? I hope you had heard the news that some glitch was there. So I had actually bought FIFA 2022 for PC at 4 rupees. I do have it. The only problem is I do not have a laptop capable of playing that. I don't think Apple laptop supports games much, so I do not have a laptop. If anyone has a laptop here in Delhi, we can play FIFA 2022 anytime you guys want. Okay. Uh, I know, Dikshit, it's fine. It's fine. You can just look back at the videos, or you can just ping me on Telegram. I'll send you a voice note. No issues. You do not have to solve question banks if you're clear with the concepts. No, no, it's not necessary. It is not that you will not get a good rank if you've not solved the question bank. I know a lot of people who have not done any question bank and they've got good ranks. My dear senior, Dr. Shiv sir, Shiv boss scored rank 1 in NEET and rank 8 in INIC, AIMS, AIMS. He never completed his modules. He told me that he was only through with approximately 150 or 180 modules. But those 180 modules, if you may, would probably the most important topics. And he was thorough with the most important topics. That's what counts. Okay. But he was thorough with his notes. He was thorough with all his concepts. And, you know, as you say, he was the best. Okay, I'll give you an example in like which modules to solve. You go through the previous year question papers, question modules, whatever you call them, wherever your sources, whatever your sources, it doesn't matter. As and when you know the previous year topic, okay, realize the topic, at least solve the topic module. Okay, that much you can do. Let's say 300 questions, 300 questions approximately. Um 300 questions in a 200 questions in a paper do not come from more than 100 150 topics. Okay, so 150 topics, fine, you can solve them, and those will be repeated again and again. 300 topics, which would not be more than, like, not one topic is covered in one module, right? So like that. I don't think he might have the list right now. He would not have his access to Marrow. If you guys want to buy him access to Marrow, I'll ask him to do that. He had the best interview. Shiv Boss had the best interview on YouTube. You should definitely view it sometime. He is the most down to earth person you can ever see. His video was amazing. I still remember it. I was there with him before. No, I did not meet him. I met him afterwards. Yeah. We'll plan something with Shiv Boss soon. Definitely. Okay, definitely we'll do that. मेडिसिन आओ आदित्य, मैं भी दूंगा यार ट्रीट. Okay, so Indiana, did you realize how to figure out what modules are important and what is not? If not, then we can do that again. Do I? You do not want to hear me sing, trust me. Main subjects to focus on INICT. Okay, definitely biotech, definitely PSM, definitely OBG. Yeah, though, and ortho can be sometimes very very destroying in INICT. But that being said, if you even if you focus on ortho, you might not get the questions right. So it's fine if you're not focusing on ortho. FMT is also very scoring in INICT. Okay, and practical pathology, stains, techniques, new techniques of staining, and new diagnostic techniques, things like that. Okay, honestly, I did not study anything after my NEET. For INICT, I just attempted one mock, did three-fourth of the July paper, solved three-fourth of the July paper. And because I had a strong base, because my basics were strong, and because I was not stressed about performing anything in November INICT, I did fine. So that's what I did. Divya. Man, Aditya, you type really fast. Main difference between INICT and NEET PG is that NEET PG you get more of topic repeats. In INICT you get the exact question repeats a lot. That is important. INICT is probably making worse paper than they were a few years back. Lesser clinical questions are being asked, more of theoretical questions are being asked, which is actually weird. I don't think so, yeah. I really don't think so. I will be awarded anything. I am. Yeah, RGU, MCU, wala, I really don't remember much, but I just remember one thing, that if there is frank blood and if there is definite evidence of uh, trauma, you do not put a Foley's. But that being said, there is a dictum in surgery. If the distal opening is patent, then the lateral injuries heal themselves. Okay, so with that concept, there has been a new concept of partially torn urethra or partially injured urethra. You do voluntarily insert a Foley's catheter under vision to let the distal patency be open and the lateral walls thereafter heal. Okay, if the pressure is high and the patient is feeling urinary retention, you definitely have to go for cysto uh, suprapubic catheterization to relieve the pressure. Otherwise, the bladder would burst and it will lead to peritonitis and everything. Um, okay, if it is not retention, if the retention is not there, you can wait and watch. I think I'm not sure. They we do not give any contrast or anything, but I think we do go undergo imaging. I'm not sure. Okay, I'm not sure about this, so I'll not say any further. Okay, but yeah, if the bladder is palpable, you can see if ultrasound is available. You can see if bladder is seen. Definitely go for a suprapubic catheterization. Yeah, NICT book by Pritesh sir is very good. You can solve that. Okay. But try to read your notes along with it instead of the explanation from there, because you'll just end up having two sources to read. That's not recommended. You can edit your notes according to the NICT essence or in the sense, but do not, keep two sources. Medicine, I would suggest two things: electrolytes and arterial blood gas. That is very, very important. Very, very important. Okay. And second is vitamins and whatever subject you want to consider them. I feel that soon enough, electrolytes and fluid electrolytes and ABG plus vitamins would form a new subject altogether, because you get 7 to 10 questions in every paper from them. Medicine teacher, yeah, a lot of people are good. You definitely can read from anyone and trust them. Okay, trusting your source is very, very important. You want a tour of my room? I don't think my room is okay. It's not that bad. It's not that bad. But no, not today. uh, I did not have the luck to do it from Tamim sir. I did get to read from one of his classes on pulmonology, which was very, very good. I attended Dr. Rajat Bajaj sir. I don't know if you know him. He is passed out from MAMC, done his medical oncology, and I attended his class at Jaipur. He had a very good class, how Harrison based class, and we really enjoyed it. He was very good at teaching concepts from the basics, so that's why it was very, very good. Pharma mnemonics are definitely important. Definitely, if you can make them, definitely do revise them. Do not make the mistake of not revising your mnemonics. That is an art you need to know, and try to correlate with your medicine and surgery, the pharma part, because the questions that are being asked, you cannot isolate them to pharma. Okay, you might start it as a question of medicine and it ends up being pharma question. Okay, so definitely correlate. Rajat sir, I think teaches with DBMCI. I attended his class was under DBMCI, but I'm not sure what he is teaching under where currently. But he is very good. I really liked him. Multiple revision of notes with previous year question topics. Okay, multiple revision of your notes, your own notes, plus previous year topics. Okay, you can chuck the question bank. Dr. R, nothing is impossible. It's definitely going to be difficult, but nothing is impossible. If you can plan a strategy for yourself to kill it, you can kill it. My advice to you would be get a some revision notes kind of a thing, get something like that. Take a previous year question uh, module or something like that, and annotate your notes according to the previous year question topics. Kill the previous year question topics. Attempt some GTs, attempt some good GTs, good quality GTs, and learn from your mistake. Rectify your mistakes. Do not wander here and there. Do not give more than a designated amount of time to your subject. That should get you in a decent position for this exam. Okay. uh, a lot of GTs have their own particular quirks and benefits. Okay, like I would summarize a few GTs might have questions from the question bank, which makes it a little easier for some, biased for some, so you do not really know. Second is some GTs have the benefit of taking it at the taking it at the end of taking it at the center. Okay, taking it at the end of, at the center. Okay, so that gives you a whole different experience, whole good experience of taking a GT at the center. So that is very very good, but at the same time that institute which constitute that paper might put in questions from their TND, but it's okay. You do not have to see the rank, you have to see your score, your mistakes, so that's fine. Okay, I belong to 2015 batch. No, I did not attempt GTs at pre PGR, bro. I attempted a lot of GTs. I had a lot of time. I attempted Maro, I attempted DBMC, I attempted DAM CBTs also. I attempted Prep Ladder GTs also. I attempted one an Academy GT also. I don't remember. Maybe. No, I did not use TND. I did not think it was uh, needed for me because I already had my notes. I knew my notes. I wanted to revise from that only. And plus, I did not want a extra I did not want an extra source. So if you already have your notes, do not do TNA. It's of no use. You'll just have an extra notes. So yeah, GTs you can frequency you can increase as and when you move forward. Let's say start once or twice a month. Then at the end of it, maybe twice a week also you can increase. Yeah, DAM CBTs are tough at times, but the only point that favors DAM CBT is that you go and give them at the center, which is a very very important fact. Okay, which is a very very important fact. You might not realize it as in then, but you will realize it later, so do attempt it. Okay, I did make a 20th notebook. No, I'm not in a hostel room. I'm currently at my apartment studio. I don't know what do I call it. It's a small studio. I have not received any gift from any JR Didis. And no, room is not messy. Okay. Anyways, yeah, I did make a 20th notebook. So I was very, very poor at remembering facts. Okay. Yeah, you'll give me a table and you'll tell me that two questions will come from this table. I'll not be able to remember that table. So I made my 20th notebook for remembering facts which were important. Okay. 20th notebook is a very varied tool in the sense that you can use it however you want to, in the form of, let's like I used it this way. I also had a GT notebook in which I used to somewhat write down some wrong concepts and some good differential diagnosis questions in my GT notebook. Some concept which are confusing, some next step questions, some clinical scenarios which can be confused with some other clinical scenarios. Let's say Four patients with heel pain. One is on starting walking, one is at end of walking, one is at all the time irrespective of walking. So that gives a good differential. Okay, yeah, you can actually use a 20th book, IFA as 20th book. No doubt about that. It's how you create your content that is important to you. Okay, feel at home with your content. Okay, that is important. Okay, so yeah, I expanded my notes, but I had short notes. I had short notes. I'll give you an example. Let's say my notes approximately of medicine. I had four notebooks, but I do write very big. In normal handwriting, that would be approximately 400 odd pages. Okay, 400 odd pages. I might have added 50, 55, or let's say roughly 100 pages if I had, but I did not. But let's say 100 pages. Then I made it to 500 pages. That was my content. That is, I had the control of my content in my hand. I had 400 pages of important things, which are the most important, and I added 100 pages to that. But what I did not have was 1,000 pages of printed notes, which were not written by me, which was not owned by me. So I did not have the difficulty in revising those notes. Are you getting my point? When you have smaller, crisper notes, you have the control of content in your hand and you can expand it as in what you want to. I hope to see you tomorrow in the gastro ward, Aditya. You will help me with the sampling. Yeah, I did not attend the classes much because I thought that I needed to revise things in order to remember anything. I did attend some classes which helped me a lot. Like I still remember I attended one class of Zena Ma'am's where she had told IV cannula flow speeds, and that was a question in INICET. Okay, so that was a good thing. And but I did not attend a much of their classes because I already had my notes. I already wanted to knew what I wanted to do with respect to the content I had. And so yeah, I could not have taken out time to revise it, so I did not see a point in attending the classes and not being able to revise it. But I really liked whatever I saw whenever I saw Zena Ma'am's class. Even Preeti Ma'am's class, I had seen some of them. Some there was one class on tables of robins, new tables of robins. That was a very good one. No, if you already have your notes and you have read it, be it in any form, stick to that. Do not waste time in your internship or in your pre PG time. Okay, making your own notes is okay if you've done it for the first time or if you are currently in your UG days. But at this hour, you have to consider time as an important factor. Yeah, definitely, Divya, you have a good recipe. You have good notes. You and FA, if you have read, that's a very good thing. Definitely you can, if you are on the right track, if you practice good questions, you can definitely get a good rank. Be consistent, have confidence, trust yourself. That's very very important. Back your options, back what you're thinking. Okay, that is very very important. So anything you want to ask me, any other thing, or should we end it, be it NEET related, be it PG related, be it anything else? There is no absolute number, SJ. There is no absolute number. Whenever you're satisfied, it's fine. And trust me, you'll never be satisfied. Even if you have done 10 revisions, no one can. Okay. If even if you have done 10 revisions, you'll think about an 11th one. Even if you have done second revision, you can score good. Okay. So there is no number to how many revisions. It's the quality of it. It's how much and you improve on your mistakes. Improving on your mistakes is your journey. It is not the number of revisions. What is BNB? I don't know. I'm not familiar with BNB. Can you please tell me? You can start with INI Essence right now. No issues. I don't know when the 2024 would come. Why do you want to wait? Yeah, watch Pediatrics preterm baby package for pediatric INI. Actually, Pediatrics is a very good channel here at Ames, and there are a lot of videos and a lot of good things on that. So you definitely can watch it. They do ask a lot of questions from that. I'm not familiar with boards and beyond, yeah, so I cannot comment on that. But it might be good. I'm really not sure. I know about Sketchy. I've heard about Sketchy. I think Micro from Sketchy is good, but I'm not really aware of boards and beyond. I'm aware of UWorld. I'm aware of FA. That's it. Okay, it's fine. Created by a cardiologist in US. Okay. So how do you guys stay motivated? Go through notebook and question bank, previous year questions, not the entire question bank. Just go through your the notebook, any whatever notebook you want to, and notes, and go through the previous year questions. Where you do not understand the notes, that part you can see from the videos. Use the videos minimally, selectively. Okay. Telegram channel I have Let's Beat PG by Dr. Arjun Kumar Agarwal. You can join that. Thank you, Aditya, for advice. I'll definitely do that. Motivation comes from inside. Motivation comes in waves. Motivation is good in any which way it comes. Okay. Oh, still, I would like if you do my sampling tomorrow. What intervention do you want? You can tell me that also. Do not live in FOMO. Come on, do not live in FOMO. FOMO is such a, you know, old world problem. It's actually old world and a new world problem. Uh, it's something that why do you want to fall in a trap which can fail you? Okay, fear of missing out is never a good thing. Something you have to do something different, right? Do something different. There is you have to give precedence to a factor, a very important factor called time. Okay, if you're starting your preparation right now, if you only have 6 months for your preparation, you do not have enough time for whole question bank. If you want to do the whole question bank with notes, with previous year questions, with GTs, you at least require 8 to 9 months. And time is important. Time is a very integral factor to your preparation. So you have to skip a lot of things in order to get a good rank. You have to skip a lot of things, I would say that. The way I'm not sure how OBG is at Ames. Actually, I'm not sure how any surgical branch is at Ames. Okay, I have heard a lot of mixed reviews. You can ask, you can come here sometime and ask if you have some free time after the paper to see the department for yourself and maybe ask some of the seniors. But I'm probably not the person to ask this. Okay, Anirudh, I at least have done 2 to 3 trips every year. I I like to travel a lot. So yeah, I do not have a count of them right now, but yeah, I like traveling a lot. Yeah, we have to do sampling. It's part of the job. I only did surgery from Jaisar. I did see some videos, some notes I had from Rohan sir of the topics which I had missed somewhat, or Jaisar had missed, whatever it was. So yeah, I did some of that. But all in all, I did surgery from Jaisar only, apart from some parts which he does not teach as such. Interns do sampling sometimes, but as Aditya says, he won't do sampling, so it's us who have to do it instead. But yeah, interns do help a lot at times. Not solving GTs would land you up in a very bad place. Think about that, and you'll not procrastinate. Think about the good things you learned from a GT. Think about the dreams you have and how the GTs would help you realize those, help you with those, and so yeah, that's what will motivate you to not procrastinate your GTs. GTs is something like, what the hell? Let's give a GT today. Okay, initially. Then you'll start to plan things. You'll plan your subjects according to the GT. And that's when it gets serious. Okay. GTs make your preparation serious. Interns do sampling at times. Don't worry about that. Before your preparation starts. Ideally, you should give your GTs before your preparation starts. Okay, to know your baseline. Otherwise, you will not know what you're improving on. And trust me, nothing motivates you more than the improvement you have. Give your first GT before you start your preparation or before you complete your first subject. That's the ideal scenario. Before you complete the first subject or before you even start the preparation. Are you getting my point? Good night, bro Aditya. Good night. Uh, you can go sleep. I'll talk to others. Taking things from GTs will come when you start giving them, and it's not a 1 day job. As in, you cannot expect to take out your everything from the first GT you give. You learn how to extract things from a GT when you start giving them and when you practice accordingly. Okay, so how to take out? Learn from your mistakes. There is nothing, no better teacher than learning from your mistakes. Okay, try to summarize the subjects. Try to summarize the topics which you are weak at, which you are making mistakes again and again. Try to see where you did silly mistakes. Try to see where you marked the questions wrong which you knew already, and what made you choose the wrong answer, and what would have made you choose the right answer. What's the reason of people's need PG rank comes bell? I do not understand that, sorry. Dikshit, which thing gave my preparation an extra edge? I was always motivated to do good for myself. But at the same time, I knew I would be satisfied with whatever result I had. So I had given my paper without any pressures. Yeah, that was basically it. And consistency. I have been reading for a very long time consistently, and I was always firm with my concepts. I knew whatever the question is, wherever the question is from, I can attempt it. I can try solving it because I was firm with my concepts. That is what probably helped me in getting that edge. My first GT rank was okay. I gave actually two first GTs, I would say. The first ever GT I gave was in my final year. It was actually a complimentary GT from E Gurukul or Bhatia with their uh, vibe. I did vibe in final year. So in that GT, I got a rank of around 3500 or something, score of 612, approximately 180 some questions correct. The first GT I gave in my internship, out of 300, I scored approximately 180 to 90, something like that. Score of 680. Okay. Uh, and rank, I do not remember. It was somewhere around 1015, 1500, I don't know, somewhere around that. But I knew that at least I know this much and I can build on a lot of things. I can build on this. It's what you take from GT is like half filled cup or half empty cup. At times you need to focus on the half filled cup to get your correct positive motivation. But at the same time you need to focus on your half empty cup to realize your mistakes, to become a better version for yourselves. Okay? Yeah, some things are not in your hand, like the reservation system, the internal quota, everything, nothing is in your hand. This is what it is. You have to fight despite everything. Okay, you cannot. Matlab, there have been cases about it, but at the end of it, what will happen is not in your hand. So instead of worrying about something that is not in your hand, all you can do is put an extra bit of effort. I did read Harrison's a lot. I only read Harrison's in medicine and up to date. I read Bailey. I read Robbins. Not the whole of it. I wanted to, but I realized it late because of honeymoon semester, maybe. And I did read Park. Yeah. Anirudh, realize your goals. Talk to yourself in the mirror. Talk to yourself daily in the mirror for 10 days. You'll realize you'll really realize how and what your dreams are, what and how you want to work, what you want to work for. You'll realize it then you'll gradually start studying again. That is how you'll make momentum again. Are you getting my point? Thank you, Priyam. Dr. Priyam, thank you. I guess this is it. I am not seeing any new questions. Tell me if you want to ask me anything about NEET, anything about MBBS, anything about my life. Ashray, read Robbins as much as you can. Do not take pressures of reading it cover to cover. Read it as much as you can. Okay, read it to gain knowledge, gain concepts, not to score an exam. Okay. SJ, we do not know what will happen. Okay. We cannot predict things right now. It all depends on you. It all depends on how you can perform on the day. It all depends on how you do every next day from today onwards for the next 4 months. It a lot of it depends on it. Can you work harder than before? Can you That will answer a lot of your questions. Can you be more confident than before? If you are more confident than before, if you have worked harder than before, then I don't see a reason why you'll score lesser marks than your previous NEET marks. Okay. No, you will not. If you're cutting down some unnecessary things, that means you'll more likely remember the more important things. That's a fact. That's definitely a fact. If you want to start with videos, you can, but you need to watch them on 2x then. You need to be time bound. You need to give time its needed precedence. You need to understand the importance of time and work accordingly. Time is very, very important to you, and it should be so. Are you getting my point? Previous year topics, previous year questions, and your notes. Do not try to read anything fancy. Do not try to go very deep into things, thinking that INICT is some different breed or some different thing. Just stick to basics. There are some topics which are asked in INICT more, like practical pathology, staining, and things like that. Biotechnology, newer biotech things, and all that techniques that you have to read, but do not go in a lot of depth in these things also. Okay, stick to the basics, stick to the previous year questions, and you will do good. Thanks, Dr. Prem. Thank you for those lovely words. I'm really humbled. You can do it from any notes that the notes you're following. You can do it from first aid, any one source that you have been following. You can do that. Any textbook I recommend for OBG. What I had done was my notes. I had read my notes. I had read Sakshi ma'am's book. I did not particularly read a OBG book, to be honest. But if you do want to read, I have heard Shaw's gynecology is very good, and a lot of people do read Datta's obstetrics, but I'm not sure about that. I'm not aware about that. Actually, not sure. I did molecular biology from Rebecca ma'am's class that I had attended in my internship, and also I did read about some things in first aid. Yeah. Give importance to time. Time is important. Time is money, and it's true. Okay. Okay. On that note, I think that's pretty much it. Let's end for today. I hope to see you guys again soon. And the next session we'll do it on a longer notice so that more people can join in and gain from it. Ashwini sir, hands down, Ashwini sir, he is the best. Ashwini sir is the best. Also, I would request all of you to share the links and everything with your friends, because at the end of it, sharing your knowledge, your sources with your friends is a good idea. Okay, trust me with that. You will learn more when you share. I have experienced it firsthand, and trust me with that. Okay, share with your friends, share the videos, share whatever knowledge you have, share the concepts with your study partners, friends, or whatever do you have. Okay, Himank, if you can trim them down, then definitely you should. Do not even try Williams. Okay, don't listen to Aditya. Yeah, I'm glad, Himang. I'm glad that you appreciate it. Thank you, guys, and do tell your friends about this. And I hope to see you on my Telegram group, and I hope to see you the next time. Do ping me about any videos you would want to see. Um, and I'll be more regular on my YouTube channel. I was not so much because of the last 6 months. I was on very hectic duties, but now that I have become a second semester senior, so I can probably spare some time for you guys making some videos. So do suggest any videos you would want for me to make on YouTube. I would definitely do that. Okay. Thank you, guys. Okay, if you have anything, I'll give you 20 seconds to ask, or I'll end the stream. Holland and Bruce is actually good, I've heard. I'm not sure. I've just heard about it. जल्दी जल्दी सेशन क्या करो मतलब लाइक मोर फ्रीक्वेंसी या फिर स्पीक फास्ट. I think about what time I have to be in what next morning, and then I have to sleep because it's quite early in the next day. Thank you, Tanya. Thank you so much. Okay, guys. Good night. Have a sound sleep. Study well. Try to focus on concepts. Important topics, you can make a list yourself and try to make it yourself. That would be better. Okay. That would be better.